Hello everyone, in this video we are going to discuss about malaria. Introduction. What is meant by malaria? The word malaria is derived from two Italian words. Mal means bad and area means air. Malaria is a disease caused by a parasite. The parasite is spread to humans through the bites of infected mosquitoes. It was also believed that the disease was caused by inhalation of poisonous emanations from the ground. It is found throughout the world, especially in tropical and subtropical areas. Each year, nearly 290 million people are infected with malaria and more than 4 lakh people die of this disease. Causative organism of malaria. Malaria is caused by single-cell parasite named Plasmodium. The parasite transmitted to humans most commonly through mosquito bites. It lives in the red blood corpuscles of the peripheral blood. These parasites are four types, which are Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, Plasmodium malaria. Types of malaria. First type is benign tertian malaria. It is an acute type and it is caused by Plasmodium vivax, which is also known as benign tertian parasite, and has a cycle of hours which causes fever recurring after 2 days. And next is the malignant tertian malaria. It is caused by Plasmodium falciparum. In this type, fever is very irregular, which may occur after every 48 hours. Symptoms are very severe and malignant. Patient will have high fever, delirium, and sometimes they may go for coma. Plasmodium ovale. In this type, a parasite which produces a mild form of tertian malaria. This type of malaria not found in India, but it is found in Africa. Plasmodium malaria, which is also known as quartan parasite, which causes fever which is recurring after every days and has a cycle of 72 hours. What are all the predisposing causes of malaria? Malaria is prevalent in the places where the temperature is 20 to 30 degree Fahrenheit and the relative humidity is 63% or more. Susceptible individuals such as troops, laborers. Seasonal factors. Mostly it is common in August to November. And improper maintenance of irrigation. It is also more common in those places where mosquitoes are present in large number and areas where there is water through tank, burrow, pits along roads and railway lines. The main source of infection is man. Man is the reservoir of infection, but the immediate source of infection is mosquito. Mode of infection. It is mainly transmitted by an infected female Anopheles mosquito sharing needles used to inject any drugs from mother to an unborn child. Transfusion of blood infected person to a healthy person. These are all the mode of infection of malaria. Mosquito transmission cycle. How does it get transmitted? A mosquito becomes infected by feeding on a person who has malaria. If this mosquito bites you in the future, it can transmit malarial parasite to you. Once the parasite enters into the body, it travels to the liver. Sometimes it can lie dormant for as long as a year. When the parasite mature, they leave the layer and infect the RBCs. This is where the people typically starts developing malarial symptoms. If an uninfected mosquito bites you, at this point in the cycle, it will become infected with your malarial parasites and can spread them to the other people it bites. The incubation period may vary according to the Plasmodium type. 13 to 15 days for Plasmodium vivax, 12 days for Plasmodium falciparum and 28 to 30 days for Plasmodium malaria. Signs and symptoms of malaria. It is a severe systemic disease which is acute and often chronic. It is usually begin with a brief and indefinite illness which is followed by malaise, chillness, fever, severe rigor with rapidly increasing temperature, which has three well marked stages. The first stage is cold stage and second is hot stage and sweat stage. In cold stage, patient feels cold, nausea, vomiting, headache, chillness. This will occur 15 minutes to 1 hour. In hot stage, patient will have high fever, that is 106 degree Fahrenheit for 2 to 6 hours, accompanied by headache, vomiting, delirium, anxiety and restlessness. In sweat stage, patient will have profuse sweating and fever will be subsides. This will occur for 2 to 4 hours. Treatment of malaria. These are all the common drugs which is used for malarial patient, but this will vary according to the condition of the patients. The first is we have 4 aminocunolines. In a anti-malarial drugs classification, we have quinoline, biguanides, tetracyclines, diaminopyrimides, 8 aminocunolines and cinchona alkaloids.